Hi everyone, today I'm going to share an example of using ClinicalKey to analyze a case from rehabilitation department. This is a 72-year-old man with esophageal cancer. He visited his primary care physician with a chief complaint of difficulty in swallowing. After gastrointestinal endoscopy and CT, he was diagnosed with lower esophageal cancer. The TNM classification was T3N1MO. 8 years ago, the patient suffered from cerebral infarction, and now he has a left hemiplegia as an after effect. Now the question is, assume you were his gastroenterological surgeon, what would be your treatment plan for him? To answer this question, we can approach to related information from the website www.clinicalkey.com. Simply input the keyword esophageal cancer in the search bar and click search. Here we can see over 10,000 of results related to esophageal cancer have come out. We can choose the source type from the left column to narrow down the result. As we are trying to grasp a brief introduction of esophageal cancer to see the overall treatment options about this disease, we can try to find the answers from the clinical overview. Usually this module will rank first when we are searching a certain disease. Actually, besides disease, we can also search a particular symptom, a special physical sign, an unfamiliar experimental examination, etc. The ClinicalKey will help you screen out any related information from its large dataset, which includes contents of journals, books, guidelines, clinical trials, videos, and pictures of high quality. Here in the clinical overview, we can see a disease from different aspects: the definition, the classification, the physical examination, the laboratory and radiologic examinations, the diagnostic criteria and procedures, and the treatment options. You can quickly access the latest information by simply click on the item you want. Here you can see the treatment options for esophageal cancer depends on the histologic subtype, stage of diagnosis, and medical fitness of the patient. In this case, this 72-year-old man was diagnosed with squamous cell carcinoma by gastrointestinal endoscopy. Next, we should try to classify this patient according to his test results. The clinical overview recommends us to classify the patients according to his disease stage. To further investigate the classification method, we can click on the classification item to see which stage our patient is in. As I mentioned earlier, the patient now is diagnosed with squamous cell carcinoma and T3N1MO according to the overall workup. Thus now we know this patient is in stage 3B of esophageal cancer. For patients in stage 3, he or she should be subclassified based on the clinical fitness after additional evaluation. The patient can be further classified into non-surgical candidate or medically fit for surgery. This method can be relied on since the content in clinical overview was edited in an evidence-based fashion by experts in different specialties. Nearly every recommendation in the clinical overview was inserted with references for us to consult. We can click on the superscript number to link to the original resource of this reference. Here, the classification for treatment options was sourced from the NCCN Clinical Practice Guidelines in Oncology. In this way, we can consult from the original reference for more information. It was mentioned that the additional evaluations are warranted to assess a patient's medical condition, their ability to tolerate major surgery, and feasibility of resection. These evaluations may include pulmonary function studies, cardiac testing, and nutritional assessment. However, the guideline did not elaborate which specific tests should be carried out for the assessment because it was not easy to establish accurate standards. So the question now is, how do we evaluate whether a patient is medically fit for surgery? To find the answer for this tricky or rather complicated clinical question, we can consult the opinions from the experts of North America. Clinics of North America is a series of journals which provide authentic opinions from a group of experts on current clinical difficulties. They help us to summarize the current experience for a certain clinical hotspot. For example, in this case, is the medical evaluation of a patient preparing for an esophagectomy. This article summarizes the practical method of evaluating general conditions of a patient from the pulmonary, cardiovascular, nutritional, and hepatic status. In this Japanese case, the author mainly consults the local guidelines for diagnosis and treatment of carcinoma of the esophagus, edited by the Japan Esophageal Society. In the guideline, the Performance Data Scale is a useful index commonly used for the evaluation of patients' general condition. Esophageal carcinoma patients with PS scores of 0 to 2, as mentioned in the guideline, were generally considered as medically fit patients. Thus, it is important to know the scaling method of performance data. In order to find the related information, we can simply search the performance data scale in ClinicalKey. Usually, the classic term or test or evaluation method are all included in the medical books, so we can filtrate the result by clicking on the book item. Here, it shows all of the results related to performance data found in the medical books. We can rank the results by relevance or date. In the content page, press Ctrl+F. We can arouse the search bar in the web page. Input the content we're searching for, then it will automatically skip to the results. Okay, now back to the case. After interviewing the patient, it was known that the patient used a gait aid and a lower limb brace to walk at home and used a wheelchair for outdoor mobility. The patient's activity declined with age, and he didn't undergo outpatient rehabilitation or exercise on his own. He spent more than 50% of the day in bed. Thus, his performance data scale was determined as 3 in his case. According to gastroenterology surgeon, the patient was not eligible for the surgery because his poor performance status on admission based on the local guideline. However, the surgeon consulted with the Department of Rehabilitation about whether PS could be improved through rehabilitation therapy. So, the Department of Rehabilitation began to consider it. Before scheduling a rehabilitation plan, the rehabilitation physician should evaluate the overall condition of the patient before intervention. First, they calculated the Glasgow Coma Scale of the patient. When we are in need of calculation, we can use this interactive tool to support clinical decisions. We can click on the item and see all of the built-in calculators related to the different specialties. Here we can simply choose the corresponding items according to the condition of the patient. Then the result will come out automatically, and the clinical decision or explanation will be recommended according to the score. The source of the formula was listed in the bottom, and we can consult them according to our needs. Now we unfold a page of neurologic disease. We can see a series of popular scores that use to assess the risks for stroke or recovery predictions. We can choose the ones that are useful to our case. For example, NIH stroke scale is also important for the evaluation of our patient. After filling in the information accordingly, we can get a total score of NIH stroke for this patient. As we can see, the patient's motor scores in arm and leg are high due to the left hemiplegia and the lack of exercise. Manual muscle test is also important for rehabilitation physician, for its results can help to define the impairment and focus a program to improve the function. What are the matters that need attention? How are the muscle graded in MMT? Are all important to the rehabilitation physician. Here we can find all the information of MMT in ClinicalKey's books. Or we can also get some visual help from another product named Complete Anatomy. By using this software, you are able to browse the detailed information about the muscle, including its starting points, the blood supply, the intervention, and you can also visualize the motion of a single muscle and design the rehabilitation action accordingly. Many physicians use this software to do patient education, including explaining the pathogenesis or treatment plan for a patient. Except for searching in the search bar, we can also search particular content in a book by using the smaller search bar that built in the web page of a book. For example, we search the functional independence measure in this book and found all the information that contains FIM in different chapters. Some books contain valuable videos of real case education. We can see the collections under the video column. For example, this video shows us the anticulatory technique for cervical rotation.
We just performed our osteopathic structural exam on our patient, and within that context, we found that the cervical region was actually the most problematic. We also found that our patient's cervical region was actually more rotated to the right. That was her position of ease. She has restriction of rotating to the left. Well, the next thing that I would like to do is I want to flex my patient's head up slightly just to localize my forces here at the axis where the majority of the cervical rotation takes place. At this point, I'm going to be cradling my right hand underneath of my patient's occiput. So my left hand is actually free now to gently grasp or cradle her chin. And I'm now going to rotate her into that restrictive barrier to the left. Once I've met that restrictive barrier, I can now gently come off towards neutral, and I'm going to repetitively engage that restrictive barrier in a smooth, rhythmic fashion.
We can browse the content from the browser, or we can click on the icon to obtain full text of a book or a journal article. In the full text, we can screenshot the table or image that's related to your issue. If you want to search a particular image, for example, to know the method of an application for a medical device, or a diagram that shows the pathogenesis of a disease, or a picture of a special clinical manifestation, you can search under the multimedia column. For example, this is a picture of a handheld dynamometer to measure the glenohumeral internal rotation condition. You can add the picture directly into the presentation or add it into the favorites for future browse. Sometimes we have questions about the indications, the protocols, or the interpretation of a special examination. Take cardiopulmonary exercise testing as an example. We can see all the detailed information in the rehabilitation reference book. And this is a chart that shows the clinical pearls of the interpretation of a report. Sometimes it is more important to assess the quality of a report rather than just to interpret without any evaluation. This is a chart that taught us how to differentiate the report that is valuable for interpretation, including how to assess the data quality, the questions that you'll need to ask the patients or the examiners before the interpretation. This is a simplified flowchart that demonstrates decision-making in the CPET interpretation. This table tells you how to identify the pattern of limitation on a CPET test. After general evaluation of the patient, the rehabilitation physician makes the preoperative assessment and draw up a plan for the next steps preoperative rehabilitation. The main object for this patient was set to improve his performance status by increasing muscle strength in both lower limbs. Considering the relatively low VO2 max, the rehabilitation physician has to decide whether improving CPET results should also be included in the rehabilitation objects. Both of the rehabilitation physician and the surgeon have to consider whether poor performance of CPET influences the prognosis of esophagectomy. The question needs answer from more clinical trials. Thus, we can search VO2 max esophagectomy complication in clinical trial column to see if there are any clinical trial that conducted to evaluate the CPET results influence on this complication. Here we can see trials that are completed or in process. We can check the status, the condition, the study type, purpose, sample size, start date of the trial. Detailed description, inclusion and exclusion criteria can also be seen in the web page. Or we can also consult expert opinions of North America on this difficult issue. It was mentioned that the routine cardiopulmonary exercise testing is a poor predictor of postoperative morbidity. More research is needed to evaluate the optimal method of cardiac stress testing in patients undergoing esophagectomy. Different opinions has presented in other journals, however. VO2 peak more than 14 to 15 predict a low likelihood of cardiorespiratory complications. After overall consideration, the rehabilitation plan aimed to improve VO2 max as much as possible before the surgery. Based on the main object, the Department of Rehabilitation designed a customized rehabilitation plan for this patient. They intended to improve the patient's PS and improve CPET through high-intensity and long-duration rehabilitation therapy. They taught the patient the importance of diaphragmatic breathing and gave him a brochure for the exercise method. On ClinicalKey, there are tons of patient educational materials that can help us taught patient how to cope with his disease. We can simply search the item. In this case, for example, we want to create a patient educational material on diaphragmatic breathing. Once we find the appropriate material, we can choose the language to print. You can fill in your advice, your contact information, and print a personal handbook for the patient. Due to the significant improvement in physical function of this patient after a successful rehabilitation cycle, the indication for the surgery was reconsidered at a preoperative conference of the gastrointestinal surgeon department. The patient finally underwent 8.5 hours of surgery, and the whole surgery was a huge success. The patient has a very quick recovery after post-operative rehabilitation. Through this case, we can see the importance of rehabilitation not only in the aspect of post-operative, but also the pre-operative rehabilitation. If it was not the efforts of the rehabilitation physician, the patient would be defined as non-medically fit for surgery according to the local guideline and can only receive non-radical therapy. At last, I would like to recommend some useful study materials for the Department of Rehabilitation. In ClinicalKey, we can find series of excellent medical books. We can simply search the rehabilitation and take a look at these books. Among them, The Essential of Physical Medicine and Rehabilitation lists hundreds of diseases that need rehabilitation therapy. In this book, we can find all the information about the disease from an aspect of a rehabilitation physician. For example, for the spinal cord injury, the book contains all the symptoms, all the physical examinations, including every aspect of examinations, and so on. It even provides you with a checklist for your daily work and the treatment options for the rehabilitation. Okay, this is all the information I want to share with you regarding today's case. I hope this will help you use ClinicalKey successfully in your own case. Thank you for watching.